Okay, so we're continuing with our various theories or models of alcohol problems and alcoholism, and we're on the seventh one, which is the biological model. It's also called the biomedical. Really what it is just an attempt to explain what it is that's different about people who have alcohol problems from those that don't. So one thing we look at possibly is family background, and that certainly makes sense. I mean, you have families like mine that have alcoholics in them from, now until people came over from Ireland, certainly. And we do know that families who have an alcoholic parent or two alcoholic parents are at increased risk, or really great increased risks. And there have been various twin studies done and that kind of thing that are kind of interesting. But for the most part, other than that, people have done a lot of speculating about what other differences might be, such as in the brain. Now, we're back to the brain again these days, but in a very different way. People were suggesting, like back in the 70s and 80s, that once consuming alcohol, your brain released some kind of chemical, much like an opiate of some sort. And alcohol is a hypnotic sedative. But that didn't really pan out. That didn't turn out to be completely true either. But, on the other hand, there's some things that are, I think, useful in terms of this particular model. So under causal factors, we're looking at genetic endowment and physiological differences, but I would look more at the genetic differences, especially as a parent or somebody who knows young people. So implied interventions are some kind of risk identification, and there are certain characteristics that make one more prone to alcohol problems, traumatic backgrounds, early than normal starts in using drugs or alcohol. If you start at 8 or 9 years old, you may develop a problem. Not 100%, but it puts you at greater risk. Poverty, mental illness, living in areas of poverty, things that are stressful, that sort of thing. So the people under this model that would be most appropriate to intervene would be physicians and people who make diagnoses, and social workers who work in those environments, like hospitals, social work, and that sort of thing. It's pretty straightforward. And to tell you the truth, most treatment centers do just inherently combine the American disease model and biomedical. I think they're distinguished by these particular authors because they really are looking at different things. But in fact, today, part of our discussion about the disease concept does have to do with genetics and risk factors and that sort of thing. It's all really part of the same package. All right?